And in a big move in India by the centre, all the e-commerce platforms have been asked to delist Bournvita. But here's the important part. It's not just Bournvita. All drinks, including Bournvita, have been asked to be delisted from the health drinks category on their portals. And this is important to understand. Why is this happening? Now, this is happening because, according to the child rights body, the health drink category has not been defined in the country's food laws. And to project something under the same violates the rules. So, therefore, as a part of this, all the e-commerce platforms have been asked to delist Bournvita or other health drinks from the health drinks category, as it were. The FSSAI, which is the Food Safety Authority in India, earlier this month also had instructed e-commerce platforms against labeling dairy-based or malt-based beverages as health drinks. Now, remember, the National Commission for Protection of Child Rights had found that Bournvita contains sugar levels much above the acceptable levels, and they had in fact asked India to initiate action against the companies that failed to meet safety standards and guidelines and were projecting power supplements as health drinks. Incidentally, Cadbury India has reduced the added sugar content in its popular Bournvita health drink by around 15%. This was last December, and this was a claim made by Cadbury themselves with respect to Bournvita. This comes amid a growing concerns and backlash from the drink's high sugar content, despite being marketed as a health supplement for children. Previously, Bournvita in particular had contained 37.4 grams of added sugar per 100 grams of powder, but in the revised formula, they had claimed the reduced sugar content, according to Cadbury, was 32.2 grams per 100 grams. The reduction, that was the quantity that had reduced, the sugar levels that had reduced. This reduction translates to a significant 14.4% decrease in added sugar, is what they had claimed. And I'm being joined at this point by my colleague Shweta. So, Shweta, two important aspects to what's unfolding right now. There seems to be a huge move by the centre. One, asking companies, all the e-portals, to delist drinks from under health category, which also includes Bournvita, because according to them, there is nothing that defines health drinks according to the food regulations.
Well, in a big move, Government of India has asked all the e-commerce and online portals to delist the category of health drinks, which includes Bournvita and several other companies. Now, two aspects which you have clearly mentioned. Point number one, what we understand is that the National Commission for Protection of Child Rights Acts, that's NCPCR, has very categorically stated that under the Act 2006 of FSSAI Act, Rules and Regulation, there is no definition for health drink. What is healthy drink has not been mentioned under Food Safety and Standards Authority of India, point number one. And this is the reason why they have asked all the e-commerce and portals to take down only category of healthy drinks. In fact, the subcategory what we usually see on the interface of e-commerce and online portals, whenever a customer or a consumer clicks on that, we get several options for this. Now, this has been very strictly said by Government of India that there should be no enlisting of Bournvita or similar drinks, owing to the fact that there is nothing being healthy in that particular drink. Also, when we look at the fact that Bournvita several times, time and again, we have seen that has been criticized by by many of the nutritionists also, that it is putting adverse effect on children as it has more content of sugar in it. And very recently, Bournvita had also come out with the official release that they have cut down on the sugar level per gram. But this is not enough, while we understand that the Government of India has taken a big decision that all the e-commerce companies have been hereby advised to take down the list of Bournvita and similar drinks from the category of healthy drinks.
Right. Thank you very much for joining us, Shweta, with all of those details.